thyroid tonight, obviously. Would you guys agree that there's like literally millions of people out there that have thyroid issues, that are on thyroid meds? And yeah, I grew up in the 60s and 70s, and you didn't hear about it then. I mean, you didn't hear at all about people having. Now, I'm not saying people didn't have thyroid issues then, but you didn't hear anything about it. And now we've got all these pharmaceuticals out there. Now, like, lots and lots of people have thyroid. They're on thyroid meds. So what causes thyroid problems? So let's look at that. So tonight we're going to, this is working perfectly in my office. Let's see. There we go. So the topics we're going to cover tonight, first of all, what is a thyroid and what does it do? Symptoms of thyroid dysfunction, lifestyle, toxic, metabolic, and environmental causes of thyroid dysfunction, thyroid and gut dysfunction, evaluating the thyroid, and we're going to talk about natural treatments for low thyroid. So we know the thyroid is this butterfly-shaped organ right down here. It's something that I examine on every new patient because I want to see if it's enlarged, if it's tender, because that will give me some information about the patient's health. And the thyroid gland influences the rate of metabolism in the body. So it produces T4. T4 is converted to T3. So the thyroid has this feedback loop. And so as the thyroid produces T4 and T4 elevates in the blood, it tells the TSH to stop this process. And so when T4 gets low, the TSH stimulates the thyroid stimulating hormone, to start producing T4. Most of the tests that people come into me with for their thyroid is a TSH test, thyroid stimulating hormone. Thyroid stimulating hormone is not a thyroid test, it's really a pituitary test. It's produced in the pituitary, and what the practitioner is assuming that if your TSH is high, your thyroid is not working because it's stimulating the thyroid, and it keeps going up, keeps beating on the thyroid to make more T4, but it doesn't tell you why it isn't working. So high TSH just says there might be something wrong with the thyroid, but it does not tell you why, which is why I don't think this is a very effective test. So if we look at T3 and T4, what do? Okay, so let's look at the molecular structure here of T3, T4. So this is T4. T4 means it has 4 iodine molecules. So you take one off here, and now you've got T3. But you take one off in the other ring, and now you've got reverse T3. And T3 and reverse T3 do opposite things. T3 stimulates the metabolism, it speeds it up. Reverse T3 slows it down, and the only difference is where this iodine molecule is located. It's pretty interesting. So both of these, T3 and T4, increase temperature and metabolic rate. They increase the breakdown of fat. They play an important role in growth and development, have a direct effect on the heart, have a significant effect on bone turnover, and affect the central nervous system, and are essential for mental development. So if we look at one way to remember this, is think of T4 as crude oil. It's pumped out of the ground, okay? Well, you can't put crude oil into your car. It has to be refined. So T3 is like crude oil that's been refined into gasoline. That's a way that you can remember the differences between the two. So T3 has to be converted from T4 to run your metabolism. So what are the signs and symptoms of thyroid dysfunction? Well, hyperthyroid, goiter, Anybody ever seen somebody with a goiter? Yeah, I mean, I have. I've had patients that have come in with them, and I've identified them. Very large. This area gets very large. Rapid heartbeat, warm, fine, moist skin, tremors, atrial fibrillation, nervousness, weight loss, increased appetite, insomnia, increased bowel movement. So here you see a picture of someone with a goiter. You see how inflamed, how large their throat is right there. And that was, you know, when I was looking for pictures, this was actually a pretty tame one. Some of them were pretty huge. Low thyroid, fatigue, poor concentration, difficulty losing weight, brittled, striated, thickened nails, constipation, depression, headaches, rough, dry skin, joint pain and stiffness, excess earwax, and hair loss in front and back of head, and the loss of 1/3 of the eyebrows, okay, of the outer eyebrows. You know, some of these in a man would be symptoms of low testosterone. Not all of them, but certainly about half of those. So it could be, if it's a male, it could be low testosterone, it could be low thyroid, you know, and that's something that we need to find out. Common problems often caused by thyroid dysfunction. So panic, order, and anxiety. So people that have anxiety, what's done with them?
Put them on meds.
Yeah, anti-anxiety medication. Okay. I just had a patient. She's coming in to see me as a functional medicine patient, and she was put on a particular medication, and it just almost destroyed her emotional affect. You know, she's put on it for, I don't know, I think she was on it for 6 months or 8 months, I can't remember. And I mean, and she still hasn't recovered from it. So those medications can be pretty damaging, okay? And, you know, maybe her issues were thyroid, and no one ever checked it out. Okay, obesity, sexual dysfunction, edema, fibromyalgia-like symptoms. Okay, and again, this is from the Journal of Affective Disorders 2002. And some other journals here, several other journals. Okay, lifestyle factors. Does your lifestyle affect your thyroid? How many believe that it does? Okay. Mm-hmm. Now I put the first one up here, high stress and elevated cortisol levels. Okay, can anybody think of any other factors which could affect your thyroid function? Lifestyle factors.
Not getting enough of minerals, nutrition.
Yeah, so poor nutritional status, okay? So can you think of some nutrients right off the top of your head that might affect it?
Iodine?
Iodine, certainly, yeah. Do we get enough iodine in our food in the Midwest? No. Soil's depleted of iodine, okay? Is there are there any other nutrients that you can think of that might, which deficiency might affect thyroid function besides iodine? Iodine's a good answer. There's some other ones. Anybody?
Cholesterol?
I wouldn't say cholesterol. That's a good answer for some other questions I might ask, but not for this one. Okay, so selenium and zinc would be two, especially selenium. So selenium is very important for, we'll talk about that in a little bit. Chronic dieting, bad for thyroid. Just general weight gain, just gaining weight, and obesity, toxic exposure. And we're going to talk about some of the toxins that can affect thyroid, but can anybody in here think of one specific toxin that we're exposed to a lot?
Glyphosate.
Glyphosate? would be one. I would say that would affect your hormones, your sex hormones more than your thyroid, but that's not a bad answer. Can you think of another toxin that we're exposed to all the time that might affect your thyroid? Anybody in here ever heard of fluoride? Yeah, fluoride. Anybody in here ever heard of bromide? Okay, those two. We'll talk about that a little bit more. Diabetes, so high blood sugar affects thyroid function. Here's a huge one. Gluten and food intolerances, okay? Big deal, okay? Lack of exercise. So any of these factors can affect the health of your thyroid. Now, can you see how, if you look at these, how the general population in the United States, why we have so many thyroid issues? Yeah, pretty easy to see, okay? So let's look at the role of the adrenal glands in thyroid function. So I've talked about the adrenal glands a lot in my talks. So I'm just going to ask you guys, what are they? What are they and where are they?
They sit on top of your kidneys.
Sit on top of your kidneys, right? What are some of the things they do?
Adrenaline.
They produce adrenaline. Okay, that's right. Epinephrine, norepinephrine. Okay, what else do they do? They help deal with inflammation. They produce cortisol. So cortisone is the man-made knockoff of cortisol. All right. They also produce all your sex hormones. So they do a lot of things that are really important. So the adrenal glands, the role of the adrenal glands, they help normalize endocrine function, resistance to stress, stamina. So the thyroid and adrenal, they work like two players on the same team. So when one struggles, the other one is taxed as well. So very important that the adrenal glands are looked at as well. Now, let's look at body temperature. If you check your temperature, let's say you check it over 6 days, 7 days, you have a thermometer and you check it under your arm, in your mouth, wherever, and it's constantly low, that's probably a thyroid issue. That's a very accurate way to test for thyroid, by the way, is body temperature. But if your temperature is up one day and down the other and up and down and up and down, that's an adrenal issue. It's not a thyroid problem. So you can actually, and this is a very accurate way to diagnose yourself, to look at your own health. Just get a thermometer, check your temperature, find out what it is over 7 days. And is it up and down, or is it constantly low or constantly high? Okay? So metabolic and toxic factors that diminish thyroid function. Now, we just talked about a little bit about that. Liver dysfunction, kidney health, because the T3 is converted to T4 in the kidney, liver, and lungs, and other tissue in the body. Heavy metal accumulation, cadmium, mercury, and lead. Okay, toxicity, we talked about fluoride, pesticides, radiation. So Carmen mentioned, what did you say?
Glyphosate.
Glyphosate, which is a pesticide, pesticide. PCBs, dioxin, phthalates. What's a phthalate? Anybody know? It's a plasticizer. It's in plastic. Anybody in here ever buy their food in plastic? Like all of our food comes in plastic, so we're exposed to this all the time. Essential mineral deficiencies, and I talked about selenium and zinc, iodine. Medications will affect thyroid. Beta blockers, birth control pills. I would say, here's what I want to say about birth control pills. If women knew how birth control pills screw up their hormones, they would never take them. I've seen many hormone profiles of women who've taken birth control pills and what they look like. Never take them. I'm not saying they don't work. Man, do they screw up a hormonal cycle badly. Estrogen, excess estrogen, lithium, chemotherapy, glucocorticoids like prednisone will affect. Why does prednisone affect thyroid? What is prednisone?
It's a steroid.
It's a steroid, okay. Steroid hormone. It's a man-made form of cortisol, okay. So you have a negative feedback loop going into the adrenals, so it suppresses adrenal function. If the adrenals aren't working right, what do we just say? Thyroid's not going to work right either because they work together. So how many people do you know have taken prednisone or take it regular? A lot of people out there. Now, here's another thing that's really, really, really important for thyroid function. Gut issues. Leaky gut issues have to be addressed when addressing any autoimmune thyroid issue. Leaky gut is probably the one consistent basis for almost all autoimmune disease. So I have several tests for gut, and to test and find out you have leaky gut, that has to be addressed with thyroid. Because what happens is, especially if you have gluten sensitivity, gluten will cause leaky gut. You'll get gluten into the bloodstream. It'll go in, and gluten, as we're going to find out in a little bit, looks a lot like thyroid tissue. So when your body attacks that, it'll go upstream and start attacking the thyroid. So leaky gut must be addressed. Okay. So in the talk I do on gut function, which I did earlier this year, here's a gut thyroid connection, but there's a gut liver connection, there's a gut heart connection, there's a gut brain connection. The gut is very, very, very important in all of these issues, and it's in the last like 15, 20 years been extensively studied. Now, back in like 2007, I was aware of this, but I didn't know how profound it was in dealing with people's health. And so I didn't look at, and there weren't really a lot of tests out there for it back then. So I didn't know what to do with it. I didn't know how to deal with it. Now we have lots of tests. There's lots of ways to deal with leaky gut. And it's a very, very, very important part of looking at health. So Dr. Aristo Vijani, he's one of the top immunologists in the country. He's at UCLA, and he's developed all kinds of tests. And here's what he said in the journal Clinical and Cellular Immunology in 2017. He said the primary foods that are responsible for autoimmunity are wheat and gluten products, pasteurized dairy products, and foods high in lectins. And that's a direct quote from him. And you can look him up on PubMed, which is the archive of all the health science articles that are published, and you'll see lots of articles by him. So if you look at Hashimoto's, this is a very low thyroid, where the body attacks the thyroid. It's an autoimmune thyroid, and this is what I was talking about. So gluten has some resemblance to thyroid tissue. So if this is gluten and this is thyroid, you can see that part of the gluten looks like thyroid. And so gluten mimics thyroid tissue, which causes the immune system to attack the thyroid. So if you have gluten sensitivity, your body will attack the gluten, but it will attack anything that looks like gluten. So if it's thyroid, it'll go upstream and attack the thyroid. This process is called molecular mimicry. So molecular mimicry can also be caused by plant lectins. So lectins are found in all kinds of plants. They create digestive, weight, and autoimmune problems in the body. So they're found in grains, like gluten is a plant lectin. legumes, nightshades such as tomatoes. So tomatoes, when you cook them, that sort of neutralizes the lectins. Potatoes are real high in lectins. I like potatoes, but I don't do very well with them. Eggplant is another one, a lot of lectins, and peppers. So there's more foods with high lectin content, but those are some. Okay. Researchers show that Hashimoto's is associated with the following 4 autoimmune triggers: dietary, genetic predisposition, infections, especially Epstein-Barr, which a lot of people have, and then external influences like things that we talked about already. So Hashimoto's also is associated with other autoimmune diseases. So if you have Hashimoto's, you may have another autoimmune disease like celiac, vitiligo, which is this change in pigmentation on the skin, alopecia, just losing, where you just lose hair, type 1 diabetes, and then like Down syndrome, Turner's and Klinefelter's, which are also genetic issues. Back in the, when was it? It was the 90s. I had a patient, I was practicing in Hastings, and I had a patient come up to me to see me from Red Cloud. And she had alopecia. And, I worked on her, I adjusted her, really nice lady. And I didn't know what to, at that point, this is like probably 96, I didn't know what to do with her. I didn't know how to fix it. Now I could probably help her because we know a lot more about it now. But she may have had Hashimoto's. Undoubtedly, she had leaky gut, which I didn't know how to test for back then. I didn't even know there were tests for it back then. She probably had food intolerances, gluten sensitivity, and all of those things I would address now. I just didn't know back in 1996. I just didn't know enough about it then. Nobody did, actually. Symptoms of Hashimoto's may show up 9 years before autoantibody tests are positive. Now, here's something else that I want to say about this. The opposite of this can be true in autoimmune disease. And I'll show you this study. I have an autoimmune talk just on autoimmune problems, but sometimes antibody tests show up years before symptoms show up. So you can do an antibody test and you can see high autoimmune antibodies to certain things, and those antibodies can be going up and up and up, and then you cross a threshold and then you start getting symptoms. So the opposite can also be true. So how do we evaluate the thyroid? Well, number one is you can evaluate iodine. Iodine is really, really important, not only for thyroid. It modulates the effect of estrogen on breast tissue, and low iodine plays a role in uterine fibroids. So, and it is involved in the conversion of estrone and estradiol to estriol. So those are the 3 forms of estrogen. By the way, which one of those estrogens is the one that's primarily responsible for breast cancer? Anybody know?
Estradiol?
Estradiol, yeah, that's right. Okay, what causes low iodine? So we talked about insufficient soil iodine. Iodine status is, if you look at the chemical family, and you'll recognize this, I'm sure, iodine, bromine, and fluorine are all in the same family, okay? They're all siblings. And so, if you're exposed to bromine and fluoride, we're exposed to fluorine in our water. They put it in our water. Bromine is, we'll show you in a minute where that comes from. So they can kick out iodine in the body. So when we're exposed to that's one way that our iodine status is negatively affected. So how do you know if your iodine is low? It's real simple. A T4 blood test. If that is low, and this is a very standard test, probably have low iodine, okay? And you don't need a lot of iodine to bring it up. You don't need huge amounts. Your body tends to recirculate iodine. Here's sources of bromide, flame retardant, hot tubs, medications, you know, bakery products. A lot of white flour is brominated. Brominated vegetable oils, they used to have it in Mountain Dew, Gatorade, Squirt. Those, I wouldn't drink any of those drinks. It's a way to kill your thyroid. Although I think they've taken brominated vegetable oil out of Mountain Dew. There's a big to-do about that. I think they've taken that out of there now. Sources of fluoride, toothpaste, fluoride dental treatments, tea, processed cereal, wine, beer, and soda, certain medications, the fluoroquinone antibiotics like Cipro. Cipro is a fluoroquinone antibiotic. Levaquin is a fluoroquinone antibiotic. So here we talk about measuring thyroid temperature with a thermometer. There's a specific thermometer called the Geratherm, and you can plot it 30 days on a graph, although after 3 days you'll know how well it's functioning. Now this one shows you take body temperature should be taken orally 3 times during the day, 3 hours apart. You can do it like that. You can do it first thing in the morning, okay? And then you just plot it on a graph and see, where your temperature is. And like I said, if it's really low or consistently low or consistently too high, that may be hypo or hyperthyroid. But if it's up and down, then you know it's probably adrenal issue. Okay, so lifestyle measures for low body temperature: stress reduction, moderate exercise, a little bit of high intensity interval training, detoxification, organic foods, avoiding glutens and lectins, getting adequate rest, good whole food, multivitamin, good nutrition. Make sure you're getting enough zinc, and selenium. Why not use just T4, which is levothyroxine or Synthroid, when the TSH is normal and body temperature is low? Well, T4 has to be converted to T3. This does not do that. I mean, if you can't convert to T3, T4 is not going to help you. If symptoms do not improve with T4 containing medicine, they do improve, they tend to reincur when the T4 is discontinued. Classic story of people on thyroxine, levothyroxine, better for 2 to 3 months and worse or not good right off the bat. This is a great test for leaky gut that I do. It's a wheat zoomer test. It'll test for all aspects of wheat intolerance, plus it'll tell you if your gut is leaking and how bad it's leaking. I like this test. It's a great test. It's a little pricey. It's over $500, but it will give you great information. How about measuring thyroid function? This is called the comprehensive thyroid test. This is the one that I do for a lot of my patients. If a patient comes into me and they've been tested and treated with thyroid medication, they're not sure that they have it, a lot of times I'll just do the thyroid antibodies just to see whether they have autoimmune disease, and if they do, then we know that they probably more than likely have leaky gut, and we need to look at that. On my regular comprehensive blood panel, I do a TSH, a free T4, and a free T3, and a lot of times that will, just looking at those numbers, will tell me whether we need to do number 6 and 7. Chiropractic care can help thyroid. The thyroid has a nerve supply, comes out of the base of the neck. So I've seen thyroid improve with adjustments over a period of months. So what are some of the nutrients that I use? So here's some of them. They're fat-soluble vitamins, magnesium and selenium. Here's some helpful herbal products. I use a product called Metabolic Thyro and Migratrol, which are really, really helpful for thyroid. I tend to have low thyroid myself, and I've taken both of these products and they're great. They work really well. Let's see. So you can dose these according to your body temperature or blood work, whichever you want to. Low-level laser. I've used this with thyroid. Works really well. Can really upregulate thyroid function very quickly if you've got a problem. Laser is very, very powerful, very well studied, very scientific. I use it a lot in my practice. So this is a summary of thyroid dysfunction. There's a lot of things that can cause it. Body temperature is an accurate and inexpensive way to measure it. And functional medicine protocols, detoxification, nutritional formulas, and low-level laser can restore proper thyroid and adrenal function the majority of the time. Sometimes when somebody's been on medication for a long, long time, not able to get off of it. I mean, your body's so used to it that you cannot get them off. So you just support the thyroid the best that you can and do the testing periodically to see if they're getting better, see if their numbers are coming down. So I would say this, if most of you know somebody who might have thyroid issues, and I want to help those people, and just have them come in, have them talk to me. Let's see what we can do for them. I had a patient come in the other day who she's got a lot of issues, and she's been on thyroid meds for a while, and so we did the autoimmune thyroid test on her. She doesn't have autoimmune thyroid issues. They came out fine. So she's got a lot of other issues that need help, but her thyroid issue, she is not autoimmune. So that means that we could probably there's probably help her in many other ways to get her thyroid working better again. Any questions about anything I've gone over?
When you mentioned Down syndromes in relation to thyroid issues, is that like the children of the women who have had thyroid issues are more typical, are at higher risk of having Down syndrome, or is it people with Down syndrome are at higher risk of having thyroid issues?
Probably the second one, people with Down syndrome. In fact, people with Down syndrome and autism usually have high levels of leaky gut, and they have definitely lots of deficiencies, lots of vitamin and mineral deficiencies. Mm-hmm. But leaky gut is a big factor, and you want to look at thyroid issues, endocrine issues as well. I haven't treated a lot of those kids, so I don't have a lot of experience with it, to be honest with you. But if somebody did come in and they brought in, an autistic kid or a Downs kid to me, I would do a lot of testing. I would look at leaky gut. I'd look at endocrine issues. I would look at other deficiencies that they may have, and try and fix. Look at another thing. Look at what are their brain fat levels. You can look at fatty acid. Do a fatty acid test. Your brain is primarily fat. So if they have the bad fatty acids, what's going on in their brain? That's another test I would do. So those are ways that you can really test function and find out what's really going on with that individual.
And then you mentioned magnesium in regards to nutrients that you should increase, as well as selenium. Are there particular supplements that you use in regards to magnesium? I know there's different types, but which is the one that you use for absorption of magnesium as opposed to as a dietary?
There's a lot of different magnesium supplements, and it depends on who you listen to. Magnesium L-threonate is supposed to be very good. I don't use that one, but I use a whole food magnesium called Easy Mag, which is a whole food magnesium. It's one I take personally. I use magnesium lactate. It's another one that works really well, very ionizable in the body. It depends on, who's doing the presentation, but there's lots of good magnesiums out there. I like Easy Mag because it's a whole food magnesium. In our bodies, we get minerals and vitamins from our food. Yes.
Is there an actual food that is great for magnesium or selenium?
Yeah, Brazil nuts are high in selenium. From what I understand, eggs have selenium. Another food that has a lot of selenium is your marine fish like tuna. Very high in mercury, high in selenium, but selenium tends to deactivate mercury in fish. So that's an interesting study. So marine fish are high in selenium. What was the other one? Magnesium.
Yeah.
Green leafy vegetables and most of your nuts are real high in minerals. So pistachios, almonds are high in lectins, and so are cashews. So I have a tendency not to recommend them as much. But your tree nuts are high in magnesium. And like I said, a lot of your green leafy vegetables are high in magnesium.
Are there any other tests that you do for leaky gut, or is it mostly that wheat zoomer test?
The wheat zoomer is the best. There's another one I do, and you weren't around for this talk that I did called the TMAO, trimethylamine oxidase. It's a blood test, and it tests for dysbiosis. Let's put it this way: when trimethylamine oxidase is high, that means you've got dysbiosis in the gut. That's probably affecting the heart. And I like that test. It's a lot cheaper than, it doesn't give me the information the wheat zoomer does, but it gives me enough information. And if that's high, then I can almost assume that person's got leaky gut, because I know they've got dysbiosis. If they've got dysbiosis, they've got leaky gut. So that would be another test that I would run. And that's cheaper. It's a lot cheaper. It's not as good, but it's adequate. Let's put it that way. It's the difference between $500 and $165. And so, when money is an issue, that's not as expensive as a test, but it's not as good either. It's the difference between a Cadillac and a whatever Volkswagen. It's the wheat zoomer is a Cadillac test for leaky gut. It is really good, but we can kind of find out something very similar using a less costly test. Okay. Anything else? Everything clear as mud? Okay. All right. So, if you want these slides, I'll be happy to email them to you. If you don't, that's okay.